Medurstand. Understanding Medicine.
Hi, I am Professor Azizur Rahman, and if you have attended my earlier lectures or you have watched those videos on congenital heart disease, so I think it will be easy for you to do this quiz. If you have not watched those videos, it is recommended that you do so first and then come to this place. And let's try this quiz now. Uh, I will just read it out. Left to right shunt is characterized by all of the following except. That means you just have to pick up one, which is not right. Pulmonary circulation is more than the systemic circulation. It is not compatible with life up to adulthood. There is no arterial hypoxemia. There is no clubbing, and with time the shunt may reverse. Let's wait for a few seconds and let's see who can come up with correct answer. I will disclose the answer after a few seconds. It is not compatible with life up to adulthood. This is not a correct statement. I emphasized in my lecture that left to right shunts many times the person may be asymptomatic or it could be just an incidental diagnosis or patient may develop symptoms later in life. So this statement is not correct. All other are true. Let's have quiz number 2 now. Okay, the second question is which of the following is not a feature of atrial septal defect? Pulmonary systolic ejection murmur, right ventricular volume overload, fixed splitting of second heart sound, central cyanosis, or pulmonary artery dilatation on CXR, that is X-ray chest. Which of the following is not a feature? So you have to identify one which is not a feature of AST. I'll wait for about 10-15 seconds and then display the answer. Central cyanosis, because this is left to right shunts and left to right shunts they do not have cyanosis. So this statement is wrong. Next, which of the following signs differentiates between three congenital heart diseases with left to right shunt? Just to remind you, I emphasize that there are many features which are common to all three left to right shunts. And the left to right shunts are ASD, VSD, and PDA. And you have to identify one which can differentiate between these three conditions. Cyanosis, clubbing, murmur, cardiomegaly, or pulmonary hypertension. Which of these signs can tell you which of the three left to right shunt this patient might have? Murmur. Because none have cyanosis or clubbing, there may be cardiomegaly in all, there is pulmonary hypertension in all. And murmur is unique. The murmur of ASD and VSD and PDA are different murmurs I explained in my previous lectures. So murmur will tell you which of the three this patient might have. So correct answer is murmur. Which of the following can differentiate between primary right to left shunt and the shunt which was primarily left to right but has now reversed. This is called Eisenmenger complex. All left to right shunts, they may reverse if not treated at an early age. There is progressive pulmonary hypertension and there is the reversal of shunt. So at the time of presentation, you have to differentiate whether this was originally right to left shunt, like in Fallot's tetralogy, or this was originally left to right shunt, but now it has reversed. When you see there is right to left shunt, okay, so now you have to tell me how do you differentiate between two possibilities: central versus peripheral cyanosis, clubbing versus no clubbing, early versus late onset of cyanosis, X-ray chest, or pulmonary hypertension. Which of these will tell you if the shunt is primarily right to left or was left to right but has later reversed? You have 15 seconds. Early versus late onset cyanosis. A cyanotic heart disease, the one with primary right to left shunt, there will be cyanosis to begin with. And if you take history, the mother will tell you that the child was having these cyanotic spells from early childhood, whereas the other person who has reverse shunt would have developed these cyanosis and clubbing much later in life. So I think that will differentiate between the two. Let's have another quiz now. If you have to choose one investigation for the initial evaluation of congenital heart disease, which one would you choose? I think this should be easy. You have choice of ECG, X-ray chest, PA, echocardiography, arterial blood gases, or cardiac catheterization. Okay, so I think the answer was quite obvious and you must have figured it out. It is echocardiography. One could make a case for cardiac catheterization, but of course, that is not the investigation of choice for initial evaluation. Some might need catheterization later to measure their pressures in the various chambers and various vessels correctly. But the first investigation of choice is echocardiography. There's no doubt about that. Now let's move on to the next quiz. What is not true about Fallot's tetralogy? So this is not true about Fallot's tetralogy. That means what is false? Systolic ejection murmur at pulmonary area, increased pulmonary circulation, central cyanosis, left parasternal heave, and boot-shaped heart. All are true except one. Which one is that? 15 seconds to answer. Increased pulmonary circulation is not the correct answer. Because of pulmonary stenosis, infundibular stenosis, there is in fact pulmonary oligemia. The pulmonary circulation is reduced. Unlike all left to right shunts, pulmonary circulation in Fallot's tetralogy is reduced, and that is the true answer in this question. Let's move on to the next one. Patients with primary right to left shunt are at an increased risk of impaired physical growth, impaired mental growth, brain abscesses, strokes, infective endocarditis, or all of the above. Yes, yes, the correct answer is all of the above because all are true. All can happen in patient with a right to left shunt. Now you have to tell me which statement is true or false. This is actually one question, but there are actually four different responses expected. Against every statement, you will tell me whether this statement is true or false. Cyanosis of Fallot's tetralogy is appreciated on fingertips only. What do you think? The cyanosis which is present only on the fingertips is peripheral cyanosis. So I'm sure you know if the cyanosis in Fallot's tetralogy is central or peripheral. Of course, the answer is false because it is central cyanosis. There is problem in the heart and blood from the right side goes to the left and then onward to the systemic circulation, and of course there will be cyanosis wherever this blood grows and there will be cyanosis everywhere. So this statement is false. Cyanosis will disappear if 100% oxygen is administered to the patient of Fallot's tetralogy. This statement is about Fallot's tetralogy. If you give 100% oxygen, will the cyanosis disappear? The answer is again false because in Fallot's tetralogy, blood never goes to the lungs. At least the major portion never goes to the lung, and the one a certain percentage which is going to the lung is getting oxygenated because lungs are okay. So giving 100% oxygen or supplemental oxygen will not improve cyanosis in Fallot's tetralogy. If there is a possibility of pulmonary disease, then of course giving oxygen will improve hypoxia and cyanosis. But if there is congenital right to left shunt, there is no improvement by oxygen supplementation. So the answer is false. Third statement, arterial blood gases will show hypoxia and hypercapnia. Again, we're talking about Fallot's tetralogy. Will there be just hypoxia or will there be hypoxia as well as hypercapnia? Hypercapnia is increased carbon dioxide and hypoxia of course means reduced oxygen. I think in uncomplicated Fallot's tetralogy, there will be only hypoxia. There won't be hypercapnia because whatever blood is going through the lungs and lungs are very efficient to remove carbon dioxide. So I think as far as I understand, there would be no hypercapnia or there would be minimum hypercapnia. Of course, if the patient goes into TET spell, there may be some hypercapnia because that leads to tissue hypoxia and there may be some anaerobic metabolism, but mostly there would be just hypoxia. And the last question, with time, shunt may reverse in case of Fallot's tetralogy. Originally, the shunt is from right to left. Now, with time, the shunt may reverse. This statement is also false because shunt which is right to left to start with never gets reversed. It's only the left to right shunt which can reverse because of the pulmonary hypertension. The right to left shunt stays and it never gets reversed. So that statement is also false. Thank you. That was it. It was a short quiz. I hope you have enjoyed this quiz also. So I think this was the end of the session on congenital heart diseases. And next time we'll take up series of lectures on rheumatic heart diseases. Thank you very much. Look after yourself and please join me in my next series of lectures. This is Professor Azizur Rahman from Medurstand. Thank you.